So Dr. Islam, question number 3. So Dr. Islam, if acid reflux is an issue that you're having, what are some ways that we can treat this? Now there's 4 main ways that I recommend when it comes to help treating acid reflux. Number 1, medical therapy does work. And for some individuals, we sometimes give them antacids, which is a short-term relief to help control some of the intermittent symptoms if you have acid reflux. So for example, you have intermittent acid reflux, or you have reflux only if you eat spicy foods. Sometimes you can take an antacid right before to help out with that. Number 2 is that sometimes we use a medication called an H2 antagonist. These are things like Tagamet, or in the past, Zantac. These are things that are also over the counter, and they're used for a little bit longer duration than antacids. Then lastly, we have the proton pump inhibitors, which are the ones that you may have seen on the internet, in which they actually suppress the acid by decreasing the acid cells that are producing the acid. By doing that, you can minimize acid reflux. But not everyone who has acid reflux needs to be on medications, and I'm the type of doctor that I want to try and see if we can get you off medications as much as we can. And sometimes the lifestyle changes can be a tremendous benefit when it comes to improving acid reflux. And sometimes some simple things can be done to minimize the need for you to be on medications, such as avoiding late night meals, avoiding some of the foods that can trigger acid reflux, like spicy foods, chocolate foods, caffeine, the things we sometimes enjoy. Sometimes having heavy meals can be that. Sometimes having meals and then lying down very quickly can cause acid reflux to occur. Sometimes also if you smoke, that can make acid reflux symptoms to occur as well. And if that doesn't work, sometimes we can also use more natural therapy. There are therapies out there like licorice that can actually help out with acid reflux. Sometimes Gaviscon is also a natural remedy that we use to help out with acid reflux as well. And for those individuals that do not benefit out completely from medical therapy, lifestyle changes, or even natural therapy, there's the option that we can also do surgical therapy as well. And in the right patient, this works effectively, and it really does help out when it comes to acid reflux symptoms, because a lot of our patients start to feel so much better whenever they do this in the right individual. That's kind of my spiel though when it comes to acid reflux. These are the most common questions I got when it comes to that as well.